For early-stage cervical cancer, radical hysterectomy with lymphadenectomy is associated with cure rates of more than 80%. In 2006, minimally invasive surgery, either robotic or laparoscopic, began to be adopted as an alternative to open surgery. Current guidelines support both approaches. This observational retrospective cohort analysis of the National Cancer Database compared all-cause mortality for women with stage 1A2 or 1B1 cervical cancer according to surgical approach between 2010 and 2013. Of the 2,461 women with early-stage cervical cancer, 49.8% underwent minimally invasive surgery. These women were more likely to be white, privately insured, and from zip codes with higher socioeconomic status, and to have had smaller, lower-grade tumors. Over the 45-month follow-up period, women treated with minimally invasive surgery had reduced overall survival, with a 65% higher risk of death from any cause than women who underwent open surgery. The 4-year mortality was 9.1% after minimally invasive surgery, as compared with 5.3% after open surgery. Using the Surveillance Epidemiology and End Results database, the investigators performed an interrupted time series analysis to evaluate changes in survival after the adoption of minimally invasive surgery. Before 2006, the 4-year relative survival rate remained stable, varying only 0.3% per year. After 2006, the widespread adoption of minimally invasive surgery was associated with a decline in the 4-year survival rate of 0.8% per year. The authors conclude that in women with early-stage cervical cancer, minimally invasive radical hysterectomy is associated with reduced overall survival as compared with open surgery. Full study results are available at NEJM.org.